So good morning, everyone, and thank you for joining us today for the Unsheltered Point in Time Count training. My name is Bree Phillips, and I'm the COC Systems Coordinator at CARES of New York, where I work with the Systems and Strategic Planning Committees. Having previously worked in street outreach, I've spent several years leading the efforts of point in time counts and look forward to supporting all of you as we prepare for this year's. After I review today's agenda, I would like to ask each lead agency on the call to be prepared for me to call on them for introductions. For our training agenda, we will be reviewing the housing and inventory chart, point in time count basics, the charge from HUD, HIC versus PIT, sheltered versus unsheltered count, confirmation of the point in time count date, review the methodology form for the unsheltered point in time count lead completion, discuss edits to the 2024 survey tool and confirm the recommended changes, as well as review the 2024 unsheltered point in time count timeline. We will then discuss the New York State Department of Health's opportunity for backpacks and review agency best practices. I'm going to stop sharing my screen for a second and begin introductions. When I call on your COC, if you could please unmute and introduce yourself, your agency, and share out if you have completed a point in time count before. So the first COC that I'm going to ask is if we have representatives from NY 503 Albany.
Hi, Tiana Minervini, Associate Director for Joseph's House Outreach Program. And yes, we have done the PIT count before.
Wonderful, thank you. Do you have anyone from St. Anne's Institute on today? Okay. Next, we will do NY 507 Schenectady.
Hi, Crystal Thatcher from Bethesda House of Schenectady. Yes, some of us at Bethesda House have done point in time.
Wonderful, thank you. Anyone from Safe Inc? All right. Next is also NY 512, which is also Tiana, who's going to cover that for Joseph's House and Shelter. Next, I have NY 519, Columbia Green.
I'm here. I'm Susan Cody from the Mental Health Association, and we have done the PIT count many times.
Wonderful. Thank you. Next is NY 520, Franklin, Essex. Do we have anyone from the Franklin County Community Housing Council or the St. Regis Mohawk Tribe?
Hi, good morning. Everett Lazar here from the St. Regis Mohawk Tribe.
Wonderful. Thank you so much for joining us today. Next is NY 522, Points North.
Hi, Ann Calamus with Jefferson County Department of Social Services. We have a number of providers on the call as well. We've done point in time before. We have some people that are new to it, and our new lead will be coordinating the effort. So we're just kind of supporting that and ready to go.
Wonderful. Thank you so much. Next is NY 523, Saratoga North Country.
Hi, this is Lori Rhodes from Captain CHS. And yes, we've done the PIT count before, many times.
Thank you. Any other agencies in Saratoga that would like to introduce themselves? Okay. Next, we have NY 601 Dutchess.
Hi, good morning. My name is Vinny Darrow with Hudson River Housing. I have not done the PIT count before, but Hudson River Housing has participated in the past.
Wonderful. Thank you so much. Next is NY 606 Rockland.
Hi, I'm Anna Kabelka from Helping Hands and have done the PIT count. We also have, go ahead, Dina. She's muted. Dina from the Department of Social Services, who also has been doing the PIT count for many years with us.
Wonderful. Thank you so much, Dina. And lastly, we have NY 608 Ulster.
Hi, Dominic Marino, Housing Program Manager, People USA. We've done the pick count many times in Ulster County. I was going to say and Dutchess as well.
Wonderful. Thank you so much. And is there anybody else on this call that would like to introduce themselves that I didn't get a chance to cover?
Hi, my name is Brooke Needham. I'm from the Waite House and we have participated.
Wonderful. Thank you, Brooke.
Hi, I'm Gavin Walters, Ulster County, Hudson Valley National Center for Veteran Reintegration, and we've done this before.
Wonderful.
Hi, I'm Mary Laurie from Bethesda House.
Morning, everyone. My name is Michael Moore. I'm the Street Outreach Program Manager for Captain Community Human Services. And yes, I have did the pick count.
I'll introduce myself quick. Kelsey Eddy, I'm the Director of Planning with CARES. Yeah, happy to see you all.
Hi, I'm Stephanie Romy. I'm with Shelters of Saratoga, and yes, we've done the pick count.
Thank you. Anyone else?
Hi, my camera's off right now because I'm on the road, but my name is Victoria and I am with Rise, and we have definitely done the pick count before.
Wonderful. Thank you very much for joining us.
I'm Mary Loria and I'm with Bethesda, and we've done the pick count before as well.
Thank you. All right, we'll get right back into our training. Thank you everyone for sharing. So for the HUD charge under section 578.7 of the COC program interim rule, COCs must plan and conduct a point-in-time count of homeless persons within your geographic area. Section 578.3 of the COC program interim rule states that the PIT counts are carried out on one night in the last 10 calendar days of January, or at such other times as required by HUD. HUD has historically, through notices of funding opportunity, required COCs to conduct an annual housing inventory chart and point-in-time count to receive maximum points in the annual COC program competition, and anticipates continuing this practice for the indefinite future. The housing inventory chart and point-in-time count data will continue to provide critical updates on national and local progress towards preventing and ending homelessness. Next, we will review the housing inventory chart and point-in-time count basics. In the past, we have had questions about the timing of the point-in-time count. This graphic from HUD's notice describes in more detail when you can conduct the point-in-time count, ensuring that you are pointing back to one single night. The housing inventory chart is an inventory of all dedicated homeless beds, which includes emergency shelter, transitional housing, safe haven, permanent supportive housing, and rapid rehousing beds. It is conducted in the last 10 days in January, and its purpose is to inform the homeless assistance community on unit and bed capacity. The point-in-time count is a count of everyone experiencing homelessness on one night. This includes sheltered and unsheltered individuals and is also conducted in the last 10 days in January. It provides the homeless assistance community with data needed to understand the number and characteristics of persons who are homeless at one point in time. The sheltered versus unsheltered point-in-time count. The sheltered point-in-time count is a count of all persons in emergency shelter, hotel or motel paid for by the Department of Social Services or a nonprofit, transitional housing, or safe haven on the night of the count. It is conducted in the last 10 days in January and is led by CARES. The unsheltered point-in-time count is a count of all persons residing in a place not meant for human habitation on the night of the count. It is conducted in the last 10 days in January and is led by the COC Unsheltered PIT leads. Be sure not to include any of the following people in your unsheltered point-in-time count. This includes individuals in an emergency shelter, individuals temporarily staying with family and friends, individuals in hotels or motels paid for by the Department of Social Services or self-pay, individuals residing in institutions, individuals residing in permanent supportive housing or rapid rehousing projects. It is important to note that some of these individuals will be captured in your sheltered point in time count. Listed here, we have our unsheltered point in time count leads for each COC, as well as the agencies that will focus on surveying youth and veterans during the unsheltered point in time count. As you can see, most COCs have selected January 25th for their point in time count date. We are continuing to confirm the proposed point in time count dates with COC boards and will announce to membership when they are confirmed. Next, we will review the methodology form in the 2024 survey tool. A difference this year is that we will only be asking you to fill out one methodology form that includes questions regarding how you will include a focus on surveying youth and surveying veterans. The purpose of the methodology form is to share how you overall are conducting the unsheltered point in time count in terms of stakeholders you are engaging, locations you are reaching out to, as well as how you are doing that with a specific focus on veterans and youth. The purpose of this is that we will need to speak to this information when we submit the point in time count information to HUD, and it will also be used in the narratives that we submit in the COC applications. If you have any further questions, please let us know. Otherwise, we would like to have them returned to us at CARES by January 10th. The next thing that we are going to
You mean
review
February
is
10th? Oh, no, never mind. I'm sorry.
not a problem. The next thing that we are going to review is the survey tool. For the 2024 Unsheltered Point in Time Count survey, the changes that HUD is requiring are regarding demographics, including race, ethnicity, and gender. For updates to the FY 2024 HMIS data standards, HUD has combined the race and ethnicity options into a single element that now allows for individuals to select as many options that apply to them. This is similar to the updates regarding to gender. I'm going to pause the PowerPoint here and bring up the actual survey tool.
Bree, as you're doing that, do you mind if I clarify two things?
Yes, please do.
Okay, so a couple things came up for me as we were going through those slides. Again, my name is Kelsey. I'm the Director of Planning at CARES and I work closely with Bree. So one thing that I want to clarify about who not to count in the unsheltered PIT count that gets a little tricky is when working with hospitals. Those in the emergency room could be unsheltered if they have, you know, if they're living in a place not meant for human habitation when they're not in the ER. But those who are in inpatient care would not be considered unsheltered, even if upon exiting they have no place to go. The other thing that I just wanted to highlight is that, so when Bree brought up, we have listed the unsheltered PIT lead, the veteran lead, and the youth lead. Our goal is that in each community, we have one entity that is playing the role of really organizing any staff members, any volunteers, any different agencies that are interested in participating in the PIT count and coordinating those efforts for the night of the count, who's surveying where. That's the unsheltered PIT lead. For the veteran and youth, you know, our attempt is to engage agencies that focus on those populations to coordinate with the unsheltered PIT lead so that we're making sure that we're capturing those populations who might be in different locations than the general pop. So I just wanted to pause and share that.
Thank you very much.
Of course.
So right here, you should be able to see our unsheltered survey tool. As a reminder, on the first page, it covers the head of household, and the additional pages cover any other members within the household. We have always included an option for completing the survey tool through observation for individuals who decline the survey and who are not approachable, and we will continue utilizing this in the tool. Please note that on the second page, we have added additional questions related to youth experiencing homelessness. And does anyone have any additional questions or comments related to the Unsheltered Point in Time Count survey?
Is it still an option to refuse to answer any questions?
Absolutely. Yep, and we'll get to that in just one second.
Okay.
All right. So these are the few reminders that we have when conducting the survey tool. The first is to know that volunteers administering the survey have an understanding, just like Stephanie said, that participation in the survey is completely voluntary. The second thing is to ensure that those being surveyed are informed that when responding to any disability questions, that their response, whether it be voluntary or a refusal, will not have any result of a denial of services for them. 3 is when conducting the survey, volunteers should not pose any questions regarding the severity of one's disability or homelessness status, where information is necessary to establish if an individual fits into a particular homeless population, for example, survivors of domestic violence. They should be informed of the criteria and asked whether or not they meet the definition. When conducting the observation tool, HUD's guidance is to not make assumptions related to someone's race, ethnicity, gender, or disabling condition. However, if you have an established prior working relationship with the client and as a result are aware of their identified demographics, you may proceed in filling out that section. Please note that this year at the top right-hand corner of the survey tool, there is a section specifically for capturing an individual's unique identifying factors. This can include their location being surveyed, as well as clothing and accessories that may assist in identifying them. Next, we will review the point in time count timeline. So today, December 6th, we are hosting a training with the Unsheltered Pit leads to discuss the point in time count date and methodology forms from the previous year. We have the draft and survey of methodologies, which will be distributed to the leads. On December 15th of 2023, an email will be sent out to membership confirming January 25th, 2024 as the point in time count date or alternative date that is selected. On January 10th of 2024, the PIT lead will return the methodology forms to the collaborative applicant or planning lead. And on January 17th of 2024, the collaborative applicant or planning lead will touch base with leads to review the methodology and hotspot locations for the count. January 18th of 2024, the collaborative applicant will send an email to COC memberships as a reminder that we are 1 week away from the point in time count. And then on January 24th of 2024, the collaborative applicant will send an email to COC memberships as a reminder that tomorrow, January 25th, is the point in time count date. On February 9th of 2024, service providers will send their data collection forms to the COC PIT lead. And on February 16th of 2024, the COC PIT lead will send their aggregated data to the collaborative applicant or planning lead. In March of 2024, there will be an Unsheltered PIT lead debriefing. And in April of 2024, a data memo will be available for your community to review. The additional tasks include in late December, early January, Unsheltered PIT leads will begin to recruit and train PIT count volunteers or program staff. Next, we have a new opportunity that we'd like to speak with you about from the New York State Department of Health. As part of the American Rescue Plan Act of 2021 and in coordination with the Center for Disease Control and the U.S. Department of Housing and Urban Development, HUD, CARES of New York was hired to facilitate the communication between the New York State Department of Health and your agencies, and to work with the participating programs to receive prepaid services and supplies. CARES is offering to all pit lead agencies an opportunity to order backpacks that are pre-packed with hygiene supplies to hand out on the night of the count. The next steps that would be needed in order to order these backpacks would be to contact Liz Chiarella. There's the email and phone number there as well, with how many backpacks that you would like. 2 is to provide information for the lead contact for ordering, including your name and contact information. This contact information will be given to the vendor in terms of delivery. Oops, sorry about that. And the delivery will come on a box truck. So if there are any barriers to that, we can work with you and your shelter to try to accommodate. We will just need to know that in advance. The deadline for ordering these backpacks are December 15th, and we will send out a reminder about this. Next is the unsheltered point in time count best practices. Lastly, we will cover these, and we will also ask to hear from service providers who have completed this in the past. So first is to reach out to your local law enforcement, community agencies, libraries, and convenience stores before the date of the unsheltered point in time count. 2 is to consider wearing agency t-shirts, lanyards, and to identify as a group and bring marketing materials or basic necessity items like those backpacks. 3 is it is safest to walk around in pairs, and before approaching a community member, pick who will lead the conversation and who will be the support. If a member of the community is not interested in completing the survey, ask if they are aware of any other locations that may not have been identified. 5 is to consider hosting an event at your agency's site or partnering with pre-existing events, including soup kitchens and food pantries. And we would like to take a moment to highlight and hear from agencies in Rockland COC that have hosted events in the past. I'll stop sharing my screen.
Well, hello. So we have hosted events, haircutting, showers, clothing, hygiene supply, really a one-stop shop for folks to get warm, get some food, talk to some providers that they may not know exist. In the past, we used to have 2 to 3 lead areas within Rockland that folks could go to depending on, the demographics. Due to COVID, it sort of has encompassed one area in Haverstraw at the Haverstraw Center, and that's worked out really well over the last 2 years. It's a large space, everybody's aware of it. And, I can't impress how important it is if you're able to get those other services in. I think one year, somebody even got massages or just real pampering self-care for either the volunteers and or, our guests. So I can't impress enough how important that is and how it works so well to keep people active in one place and really be able to build relationships.
Wonderful. Thank you so much for sharing.
You're
And are there any other agencies on this call that are going to consider hosting events this year?
So at Captain, we plan on having our open house drop-in on the same day as the pit count. And so then we'll get a lot of youth for the youth pit count for that.
Thank you for sharing. Any other agencies?
This is Dominic. Go ahead, Stephanie. Sorry.
I was just gonna say that our CoBlue, we can look and see what we can add, but we have services anyway because our CoBlue is currently open. So we'll try and invite people in, even if we know they're not staying with us. We know a lot of people who are out camping still. So we can kind of just invite them in for the day and remind them that our services are open and available.
Wonderful. And Dominic?
I was just gonna say that we did last year at People USA. We had an event here last year and open to the public. And as we were out doing the pig count as well, we're still discussing how we're doing everything in each county with our COC. So I'll have more on that. But hopefully but we have done it. We did do it last year.
Awesome.
We would like to do it again.
Thank you so much for sharing. All right, I'm gonna go right back to our training. So the last thing that we just have is to talk about the immediate next steps and ask if there are any final questions related to the unsheltered point in time count. As a reminder, the next steps following this presentation is to complete the methodology forms, which will be sent out to you shortly, and they are due on January 10th, and then begin reaching out to your community to prepare for the upcoming count. Does anyone have any final questions related to the unsheltered point in time count?
I do. So my question is the backpacks, is it one bag? Usually we fill up bags with stuff. So is the backpack per person that we find that's unsheltered, or is it a backpack that carries everything in it, or is it for them?
Sure. So the backpack will be actually pre-filled with hygiene supplies, almost like go bags that street outreach teams utilize. And when you order them, they will come pre-packed, and they are to be able to be handed out to individuals that you are surveying.
That's great.
Yeah, usually it's nice to have an item that you can kind of give them in return, and we actually have the money this year to be able to support that for you all.
Okay, great. That's good, because we usually figure out we usually buy our own stuff, but that's good. Thank you.
Absolutely. Yep. Any other questions?
Can I ask, was there anything on the survey? Again, the survey tool was only updated with two things. One, what HUD is requiring, which is that people can select all that apply related to race, ethnicity, and gender. And two, just to incorporate some of the questions that the Regional Advisory Board on Youth Homelessness have used for a specific youth count in the past. But are there any questions or concerns about that survey tool? Anything else, other edits that you think would be essential based on doing this in prior years to make it helpful? Okay, good. Just wanted to be sure. Thank you. Oh, go ahead.
Hi, my name is Lucinda. I'm with the Hudson Valley National Center of Veterans Reintegration. Sorry. I was just wondering if on the survey there is a spot that identifies the member if they were in the service. There's okay. Thank you.
Absolutely.
Good question.
All right. Any final questions?
Yes, actually, I want to say, when anyone asks the questions about veterans, you should definitely ask if you ever served in the armed forces, because some veterans don't identify themselves as a veteran and won't think of themselves as a veteran. But if you pose the question as, have you ever served in the armed forces, a lot of people will be more inclined to say, yes, I've worn the uniform. So I just want to give everybody that take.
Thank you for including that. That's very important. And are there any other best practices that people want to share? We've got a few minutes. All right. Well, that is all that we have for you today on today's training, and you can look out for an email that will be coming from us at Cares to You, which will include the methodology form, the survey tool, and information on those backpacks and how you can order them. We really appreciate you all joining us today on this.